testimony on behalf of small business owners and the difficulties they face in providing for their employees. I'm Barbara Burke. I've been a member here of Temple Israel for 18 years. I've been an active member of GBIO and have worked on with the healthcare team since 2004. And like Mr. Valley, here at Temple Israel, we also are a congregation full of healthcare providers, behavioral health providers, doctors, nurses, small business owners, all of whom, along with our general congregation, care very deeply about the work we're undertaking tonight. As Mr. Valley did a minute ago, we are going to go through the same exercise. I will briefly introduce 4 leaders, asking each of them 2 questions, one general question and one specifically prepared for them. As before, may I respectfully remind each of our speakers that their limit is 4 minutes. The first question that all of our speakers will address is this. Please describe specific and measurable ways that your organization is working to meet the cost growth benchmark while promoting the delivery of high-quality health care. Mr. Dreyfus, I'm going to ask you to come to the podium. Our first presenter is President and CEO of Blue Cross Blue Shield of Massachusetts. We thank you for joining us. And your organization's specific question is, as the CEO of the largest health insurer in the state, you've been outspoken of the need to move towards a system of paying hospitals and doctors that values both quality and less wasteful spending. However, CHIA, and we all remember what that is, right? Center for Health Information and Analysis. CHIA, in its August 2013 report, notes that despite these goals of yours, the large payers in our state, including Blue Cross, have not been successful in using their size to drive down costs. Can you explain why that is and what you can do about it? Thank you.
And I want to add my appreciation of GBIO, and I supported and held hands and fought with GBIO in 2004 and 2005 to pass our landmark law in 2006, and I just want to say to GBIO, keep fighting, keep doing what you're doing tonight, because it's making a huge difference, and my congratulations to Aaliyah and to Sherry for all the work they've done. I also want to thank Temple Israel for hosting this. It's good to be here tonight and be back here tonight. And if you want to know what I looked like when I was 15 years old, there's a photo on right past the library on the first floor, my confirmation class. And Rabbi, if you would allow me, I'd say the one thing of anything I learned while I was here as a student at Temple Israel was to question. Judaism is a religion of questioning. So I'm actually going to question my question a little bit tonight, if you allow me. Because the question for me at Blue Cross was, should we use our size, in essence, to be more confrontational with these colleagues of mine on my right? And I think it's the wrong question. Because while we do work hard, and I think each of them would testify that we can be quite tough and vigorous and vigilant in our negotiations, that the solutions that we all seek tonight are going to come from collaboration, not from confrontation, between hospitals and health plans, between employers, patients.